Good afternoon. My name is Danielle Lewis. I'm here today to discuss with you what is the national opioid crisis. I'll be discussing how it affects Americans today, why it is considered a national crisis, and the impact that it has on substance abusers, the impact it has on the healthcare industry, and also ways that we can help those that are considered to be substance abusers. So, first of all, let's dive into the topic of why is this a national crisis? So, first off, opioids are prescription narcotics such as oxycodone, MS-Contin, or OxyContin. There are also synthetic forms in the form of fentanyl, and fentanyl is used in pain management, like with patients that have advanced cancer pain, things like that. Um, Also, heroin is considered to be an opioid. So, whether someone abuses a drug, either a prescription drug or an illicit street drug in the form of heroin, they can become a substance abuser or user. Sometimes they're referred to as severe substance abusers. However, this is how we became to be a nation that is in crisis. So, back in the early 1990s, pharmaceutical companies pushed heavily for prescribers to promote prescription writing for these opioid medications. They were cheap to produce. They were a fix for the patients that suffer from chronic pain, and the pharmaceutical companies guaranteed that these would not be addicting medications. That patients, it would be highly unlikely that patients would become addicted to these prescription painkillers. However, they were badly mistaken. So, beginning in the 1990s all the way up until 1999, 2000, they discovered that people are highly addicted to these medications. They develop a dependence, a tolerance, and it becomes an addiction. So, yes, these medications do treat chronic pain, but it doesn't solve the problem. It just gives them a buffer, so to speak, to be able to manage the pain. Once that prescribers discovered that patients are highly addicted, and once the nation realized that there were millions of people overdosing on these medications from not taking them properly, then they decided they needed to intervene. And so later in the 2000s, there were policies in place that became adapted to help restrict the use and the prescribing of these medications. So, just to think about this in a scenario, here's one statistic I find interesting. From www.drugabuse.gov, they state 128 people die every day in the United States from a drug overdose. That is a substantial amount of people from a drug that is prescribed. Sometimes it's not always prescribed. They can seek these medications illegally, but for the majority of it, they do have prescriptions, but they just overuse this medication. Now, why do they overuse this medication? Let's think about it in reality terms. So, once you're on a medicine for an extended period of time, you become tolerant to that medication. So you will not be able to achieve the therapeutic effects of the original dose that you started out with. Your body becomes tolerant to this medication. So as tolerance develops, the patient requires higher doses of this medication to reach therapeutic benefits. So that is considered a tolerance to a drug. Now, also, you can become dependent on the drug. The difference in being dependent is once a person decides to stop taking this medication, they will suffer withdrawal symptoms, which is evident in many of these cases, and these patients can't stand the feelings of withdrawal, so they go back to using the drug if they can possibly get it. Now, you have tolerance and you have dependence, but you also have what's known as an addiction. This is when a person has used a medication for extended period of time, and they require that medication no matter what. They cannot go without it. Their body has to have it to function. Now, addiction is considered a disease. So you would likely be treating this person just like they have any other disease process. They need supportive measures as well to be able to overcome this addiction. So that is how we have gotten into this shape, because in the beginning, these medicines were great. They were overprescribed. They were used for chronic pain patients. And until people realized the severity of overdosing effects, then it started becoming a national issue. So in 2017, more than 47,000 Americans died from overdose from opioid medicines. That's significant when you think about that amount of people that were prescribed these medicines to help them, and it eventually harmed them more than helped them. Also, 1.7 million people suffer from substance use disorders, and that's in America. And these are statistics from 2017 that were found on cdc.gov. So it is an issue that is very severe, and there are ramifications for what this country can do to combat this issue. Now, as I spoke of before, such medications as fentanyl, it's a synthetic opioid that is 50 to 100 times more potent than morphine. And as I said previously, it is used in the treatment of advanced cancer pain. This medication also is made and sold on the black market. And not too long ago, there was what you would consider a bad batch, a street drug batch, that was also laced with formaldehyde and other bad drugs that, for whatever reason, whomever manufactured it did this. So there were several people that died from their initial dosing of this medication, which they had taken fentanyl in the past, I'm sure, or they wouldn't be seeking means to get it. But, you have to be careful, because substance abusers will do anything they can to fight these withdrawals or to fight these addictions. So they do turn to the black market, because it is so hard to get these medications, legally now through a prescription. Another statistics that is interesting is $205 billion. That is the economic burden of opioid abuse. That is to our country. It stems from having to change the way we treat patients. There was a spike in emergency room visits, a spike in EMS or paramedics being called out, having to Narcan patients, which is when you give them an antidote to reverse the respiratory depression that comes from these overdoses. These things had to be ramped up. The way we treated patients had to get stronger as far as fighting these overdoses. Also, another thing that came into play was policies that were passed regarding e-prescribing and prescription drug monitoring programs. So basically what this is, if you work in a healthcare facility, you know that it is a requirement, or it is likely that they would prefer us to provide electronic prescriptions rather than handwritten prescriptions. In the past, they have not accepted e-prescribing for scheduled drugs, so it really, in essence, doesn't solve that problem. I'm not sure if that is about to change. I have heard different or read different literature that is about to change, but for the moment, e-prescription supposedly cuts down on error and overuse of certain medications. The prescription drug monitoring program is where certain states have passed this, not all states, but this is where there is an online site where you can go and view what prescription medications, as far as narcotics, that patients have gotten, if they abuse polypharmacy, or if they doctor hop to different places for pain, and they're requesting pain medicine. You can actually monitor what they have, how much they have gotten, who prescribed it, when they received it. So that, I do think, is helpful, because when you come into an ER and you don't know a patient, that provider will learn more about their history and be able to treat them better and reduce the risk of overdose. Signs and symptoms of an abuser. Just a quick run through of this. You're going to find people that lack motivation, people that they distance themselves from friends and family, At work, they may be drowsy, irritable, just not completely with it or not the normal self that they would be. Now, many of these people have been on these drugs for years, so it's hard to identify, if that's their normal reaction or if they're actually taking some type of opioid medication. One thing to do is identify any risk factors that are in your place of employment. Watch for any suspicious activity. If you're a healthcare provider and you see another nurse or another healthcare worker that suspiciously hangs around your AccuDose or your med dispense, watch for things that are suspicious and report those things to your superiors, because it is important to keep up with and identify these issues because it can save someone's life. The workplace needs to develop methods of detection and also educate other employees on the importance of seeking these out and finding, anyone that is at risk and showing signs and symptoms. Another thing we can do is work with our social workers and help these patients find rehabilitation centers, programs that will help them to detox off of these medications. Most hospitals or facilities have great social work, and they're able to place them or find a program that will work with them. Also, as a nurse, it's important to try and teach alternative methods for pain control, whether it be distraction, whether it be meditation. Sometimes you can teach just calming effects that patients can use music or movies or anything to distract them from the pain and help them learn to manage the pain. And some even turn to things like acupuncture. But whatever works for that patient to keep them in a therapeutic range and away from an overdose risk with these medications, that's the important factor here. So all in all, our country is in a national crisis because we are losing millions of people every year, and it's too much. It suffers the patient's health, it suffers their family, everyone suffers when there is a substance abuse user. So the important things are to look for signs and symptoms, help these patients in every way that we can, and help find them rehabilitation or alternative means of pain management. Thank you very much. Have a good afternoon.